As you all know, artificial intelligence is becoming an increasingly important topic in dentistry, and it is commonly mentioned and spoken about in interviews. And it's particularly important to know how dentists can use it to help manage patient care. One of the main ways that AI is used in dentistry is through the analysis of X-rays. Dental X-rays are essential for identifying issues such as cavities, infections, bone loss, and other abnormalities that may not be visible in a routine inspection. AI can be used to analyze these X-rays quickly and accurately, helping dentists spot problems at an early age. By using AI to analyze X-rays, the time it takes to identify abnormalities in the mouth and teeth can be significantly reduced. Instead of relying only on manual checks, dentists can use AI as an additional tool to highlight areas of concern. This makes the diagnostic process faster and more reliable, which is especially important in busy dental practices. Early detection can also mean that problems can be treated sooner, potentially preventing more serious and painful issues from developing later on. Another major benefit of using AI in dentistry is the creation of more accurate and personalized treatment plans. Every patient is different, and AI can be used to help dentists take into account individual factors such as dental history, X-ray results, and current oral health. This allows treatment plans to be tailored more specifically to each patient's needs. As a result, diagnosis can be carried out more efficiently, and patients are more likely to receive the most suitable treatment for their condition. These improvements in diagnosis and treatment planning can have a wider impact on the NHS, as faster diagnosis and more efficient treatment planning can reduce appointment times, which in turn can decrease waiting lists. Long waiting lists are a major issue in NHS dentistry, and AI has the potential to increase access by allowing dentists to see more patients in the same amount of time. This could make dental care more accessible to those who may struggle to get an appointment otherwise. AI can also play a significant role in reducing the admin workload for dentists. One way it can do this is by taking notes automatically after patient consultations. Using voice-to-text technology, AI can listen to what the dentist says during and after the patient and convert it to structured clinical notes. This removes the need for dentists to spend long periods writing or typing up notes themselves. Reducing the amount of time spent on admin is extremely important in dentistry, as it can take a large proportion of the dentist's day, and this time could be spent treating patients instead. This also reduces stress and the risk of errors that occur when writing notes quickly and during during an appointment or at the end of a long day. As dentists can save time on admin, they can see more patients overall, and this helps reduce wait times and improves access to dental services. And more importantly, dentists can prioritize patient care, giving them more time to communicate clearly and explain treatments, and provide better overall care. This way, AI does not replace dentists but supports them and makes dental services more efficient and patient-focused.
On this slide, I'm going to talk about how clinical procedures in dentistry are being transformed by artificial intelligence and robotics. Firstly, The use of AI in dentistry has significantly improved workflow and administrative efficiency. AI systems can help dentists detect and diagnose the early stages of oral abnormalities, including issues that may not be easily visible to the human eye, such as small lesions or early decay. This allows problems to be identified earlier, improving patient outcomes. AI also supports virtual consultations and teledentistry through virtual assistants. This makes dentistry more accessible as patients can receive advice, preliminary assessments, and appointment management remotely. In addition, AI can analyze patient data and previous treatment outcomes to create tailored treatment plans, meaning care is more personalized and precise. Secondly, CAD/CAM software has revolutionized dental restorations. Traditionally, fabrication techniques relied on physical impressions, which could be uncomfortable for patients and time-consuming for dentists. CAD or CAM technology replaces this with digital scans, allowing dental designs and restorations such as crowns or bridges to be designed and manufactured accurately and efficiently. This improves comfort, precision, and overall treatment speed. Currently, robotics is already being used in dentistry. For example, orthodontic articulators help simulate jaw movement, allowing restorations to be designed with greater accuracy. Virtual reality simulators are also used in dental training, giving students and professionals the opportunity to practice procedures in a safe and controlled environment. Looking to the future, dental robotics and AI are expected to continue developing rapidly. Robotics may play a larger role in surgical procedure performance, increasing accuracy and reducing human error. As technology advances, it is likely that AI will be increasingly used in more complex dental procedures, further improving efficiency, safety, and patient care. As a fun fact, in July 2024, history was made when, for the first time, an autonomous AI-controlled robot successfully performed an entire dental procedure on a human patient. The robot prepared teeth for crowns and completed the task up to 8 times faster than the average dentist. Although this technology has not yet received FDA approval, rapid advancements in dentistry suggest that tools like this could be integrated into dental practices in the near future. Rather than replacing dentists, these systems are expected to assist with complex cases, enhance treatment efficiency, improve patient outcomes, and increase the number of patients that dental practices are able to treat. Overall, AI and robotics are reshaping dentistry by making treatments more accurate, efficient, and patient-focused. Thank you.
Today, I'm going to talk about patient care and patient experience in AI-driven dentistry. In dentistry, AI is mainly used to analyze dental x-rays, scans, and patient records. For example, AI software can detect early signs of tooth decay or bone loss that may be difficult for the human eye to spot. It can also assist in treatment planning, such as predicting tooth movement in orthodontics. However, it's important to emphasize that AI supports dentists. The final clinical decision is always made by a trained professional. One of the biggest benefits of AI patient care is earlier and more accurate diagnosis. By detecting problems like cavities or gum disease earlier, dentists can treat patients sooner and often in less invasive ways. AI also allows for more personalized treatment plans, as it can analyze large amounts of data from similar cases. This reduces the chance of human error and leads to a better long term oral healthcare outcome. AI doesn't just improve clinical care, it also improves the patient experience because our appointments can be shorter because AI speeds up image analysis and decision making. AI generated visuals can also allow dentists to clearly show patients what's happening in their mouth, making explanations easier to understand. When patients can see and understand their diagnosis, they tend to feel more confident and trust the treatment being offered. Despite these benefits, there are important challenges and ethical concerns. Patient Patient data is sensitive medical information, so privacy and data security must be carefully protected. There's also a risk of bias because if AI systems are trained on only limited pieces of data, they may not work equally well for all patients. This is why human judgment is essential and why patients must give informed consent when AI is used in their care. To conclude, AI has the potential to significantly improve both patient care and patient experience in dentistry. It can lead to earlier diagnosis, more personalized treatment, and better communication with patients. However, it must be used ethically, transparently, and always along humans. Ultimately, trust, empathy is central to dental care, so these can all only be provided by humans. Thank you.
In September 2024, the General Dental Council, also known as the GDC, commissioned a rapid evidence assessment to examine how AI is currently being used in dental services. The review also looked at what this could mean for dental professionals, patients, and the wider dental sector in the future. This research was conducted by the University of Plymouth, as well as experts in AI and robotics. This was part of the GDC's wider work on monitoring new technologies and how they might affect dental regulations and practice. The aims are to understand the current use of AI in live dental service delivery, its benefits, risks, and challenges, including implications for equality, diversity and inclusion, and data protection. It's also aiming to understand future areas of development in AI applications, methods used to evaluate the role and impact of AI, and gaps in the evidence base and priorities for future research. Systems such as the Yomi robot already help to improve accuracy and precision for dentists. It is the only FDA-cleared robot system from dental implant surgery. Oral-B has created a toothbrush called IO5 electric toothbrush, which has toothbrush connectivity to the Oral-B app and Apple Health. It uses AI brushing recognition to recognize your brushing style and help you to brush better. This allows deep learning so caries can be detected through smartphone apps that analyze intraoral images. Although AI shows clear benefits such as improved accuracy, better patient outcomes, and increased access to remote care, the review also identified several risks and challenges. These included safety concerns when using robots on patients with poor bone quality, the need for proper training for dental professionals, and possible patient anxiety during robot-assisted treatments. As well as this, the Association for Dental Education, also known as the ADEE, have been looking at ways to embrace future technologies without compromising academic standards. They have looked at things such as generative AI, iterative learning, rule-based AI, predictive AI, conversational AI, and assistive or reactive AI. Predictive AI is used to predict future trends based off of current data and how different factors have affected past data. Rule-based AI would be used to uphold predefined rules such as grammar checking documents and automatically grading assignments. Generative AI would be used to create new content on data such as data patterns such as educational games. Conversational AI would be used to imitate human interaction and would be particularly helpful to ease people who have social anxiety into developing the conversational skills needed for a dentist to be able to conduct appointments. This minimizes these barriers, encouraging more people to pursue a career in dentistry, and it can also allow students to practice taking patient histories, and it could be used to assess their ability to obtain accurate information. Assistive or reactive AI is the AI that most people about when we talk about AI in the future of dentistry, and this is the use of robots and assistive tech to help future dentists in a clinical setting. Many different organizations have looked into the various ways we can incorporate AI without compromising standards, and it is important that we stay up to date, as this could directly impact the way we learn at dental school and the way that we work as dentists within a multidisciplinary team in a clinic. It is also a very important topic to be aware about, as it has started to emerge a lot in interviews. Thank you.